And today, Dr. Tom and Karina Lozano, surgical liaison, are exploring the world of Sculptra and will bring us along. A reminder, Dr. Tom has a special now. It's through the end of October. You can buy one treatment of Sculptra and get a second treatment for 50% off. Very nice.
Pretty cool deal,
I
huh,
love
Michelle?
it.
I like
Yeah.
that 50% off.
Who doesn't love that?
Well, thank you for that wonderful introduction. And we're having boy, we've had some wonderful weather, haven't we?
It's been great, yeah.
Oh, I
just
love
not too
this.
hot,
I know we're not
really
fall
nice.
yet, but it
Right.
feels like we're transitioning into a wonderful time.
Yes.
And Karina, thank you. I don't even know why I have to keep on introducing you.
Hello,
Just-
everyone.
Hi, this is Karina Lozano, who is our surgical liaison, surgical scrub tech, as well as medical assistant. And so I know that today Michelle always, texts me or emails me, what's our topic? And so we always pick a topic, and then lo and behold, we have a patient walk in, and
Right.
they're having that treatment that day. And again, it just happens that way. And,
Don't plan it.
And so it happened again today, and we're going to talk about Sculptra. So, Karina, as we were driving over,
Yeah.
we're kind of just summarizing, what do we want to talk to our audience? And by the way, thank you everyone always for listening to us over these last, I don't know, how many years have we been doing this,
I think it
Michelle?
might be like 18 now.
18 years here on
Wow.
KSRO Ask the Expert. So thank you all so very much for listening. Karina, you and I were talking a little bit about it, and I said I wanted to kind of introduce it by chatting about you.
Of course.
Of course, we're going to talk about you, all right. And so, Karina, can we tell everybody how old you are?
Sure.
Okay, how old are you?
I'm 28.
Okay, you're 28. Well, you lie in the office. You say
I
you're
say 25,
Okay,
but
all right.
28, I guess I have to spec
Okay,
up.
so you're 28 years young, okay, and I'm a baby boomer, okay. And so tell me, as you we're doing treatments
Right.
and all, and you know how looking our best can help us to feel confident and so forth
Right.
as we move through the world. What were you thinking that you might do as you get older, like when you become 29?
Oh my goodness. Yeah. Well, skincare is always my major routine. I have a
Okay.
good skincare. And then the modulators, the Botox Dysport has been fun to
Okay,
do.
so
those
for-
are the good things.
Right, so for the new listeners, you're talking about your skin,
Yes, yes.
and we know that that's really one of the first things that people look at when
Right.
we interact, and so having healthy looking skin leads us to look more vibrant
Right.
and more youthful and a lot of times more attractive. So you great that you're focused on your skin, and then you said the modulator, so they may not know what that is. So what are you talking about?
Botox Dysport.
Botox and Dysport. Okay, so what does Botox and Dysport do?
The good old freezing the muscles.
Freezing the muscle. Okay, so that's what people think. It freezes muscles, but actually it weakens the muscles of expression that we may not want. Okay, so you can still smile, you can look happy, you
Right.
can look interested, but maybe it's that frown that scares people away or makes you look like you're angry. And so treating those things,
Right.
the crow's feet, forehead line, so you're thinking that that's something that you would add to your beauty
Right.
regimen. Okay. And so after you take great care of your skin, you're doing Botox and Dysport on your face to kind of soften things, if you will, make you look the pleasant person that you are. What else would you add to that program?
Yeah, I would definitely consider the Sculptra treatments as we get into my 30s, mid 30s, early 30s, mid 30s, for I guess it would be preventative for myself. Yeah.
Preventative. Okay, so you mentioned Sculptra, and so for those who maybe haven't been listening to us for 17, 18 years, and they may not know what Sculptra is, let's just backtrack a little bit. Okay, so a lot of times in the world of aesthetics, and I'm that old, I've been there from the beginning, it seems like, we used to have a very popular treatment called fillers. And some of the brand names are Restylane and Juvederm, and there are others. And so initially they were brought onto the marketplace and for patients, and we would fill, believe it or not, with little needles, we would actually fill lines, okay? And the component of that was hyaluronic acid, which is like a gel, and it's ubiquitous amongst living things. So it's a naturally occurring part of collagen in our different parts of our body, hyaluronic acid, okay? Or I like to say gel because it just sounds nicer as opposed to an acid, okay? And so people would have that, and then we transitioned from injecting them directly into a line, Karina, into maybe plumping up the cheeks, okay? Of course, women would do that for their lips and men as well, okay? And so they would fill things, if you would, in the face. Sculptra, as you said, without, and we'll jump into it in a minute, exactly what it is. You said you would like to do that almost prophylactically. What is it about a Sculptra treatment, which is an injectable? What is it about it that you like that seems to be more appealing to you as you move from your late 20s into the next decade?
I think it just has more of a natural result. It just gives a more harmony to the face. It's not an immediate like filler where you're getting the initial plumping of the face or the areas that you're already lacking volume. So I think I like that, and it's stimulating your own body. So
okay, all right, like great. That. So let me get into that a little bit. Okay, so Sculptra actually has been around for decades. It was actually around before fillers, okay? And we now use the term biostimulators, okay? That's kind of the key hashtag word now. It's everybody's talking about that in the world of cosmetic medicine or aesthetics. And so what it is it's a powder, and we mix it with water, and we're going to talk a little bit about that in a bit, and you're going to, as we describe the treatment and how you help me to perform Sculptra treatments. But what it does is it's injected, and it stimulates the body to create its own collagen again. Okay, so you're actually using this to stimulate your body. That's why it's called a bio, meaning your biology, biostimulator. It's actually making your body create collagen, okay, which we begin to lose, and believe it or not, sorry, Karina, but you begin to lose it in your mid-20s. Yeah.
I know.
You know. Okay. So wait till you get to be my age. Okay. So so it helps to stimulate collagen production, and actually, I said it's been around for decades. It was first FDA approved for this poor subset group of patients, and it was the HIV patients. So it was, and a lot of times in the beginning, a lot of men, and although it does affect women as well. But what happened is that you would get these men in their 20s and 30s, and they, due to the wasting of the disease, and it's called facial atrophy, okay, so the face and atrophy, meaning the loss of volume of the fat, that they would look multiple decades older, and not just older from a cosmetic standpoint, but it made them look unwell. In other words, it made them look sick. It made them look diseased, and many times I've described it as they then became the pariahs of society, okay, with all the fears of that at that time. Luckily now we've had wonderful treatments. People can be literally, quotes, cured, if you will, of that, or at least put that virus to rest for a long time. But these patients, and especially young men, they looked emaciated, and so they would take Sculptra and they would inject it into the face, and it would plump up and add volume to the face and make them look healthier. And so a lot of times for especially young people like yourself, okay, in your late 20s, is that okay if I say late 20s? Sure. Sorry, Karina. Okay, so in your late 20s, that you're beginning to lose collagen, and you're thinking more along the cosmetic aesthetic lines. Eventually what will happen is, and you'll realize that as we get older, we want to look healthy. And so if we can make you look healthy, that absolutely translates into more vibrant, it translates into younger, it translates into more attractive for men and women. So think of Sculptra as making you look healthier, okay? So Sculptra can help us to in general look healthier. And so you like it, you say, because you feel for you, especially at such a young age, and maybe when you're, I mean, who knows, you could ask me for tomorrow or today when we get back from the studio, or a couple of years from now, when you have that. What is it about the results with Sculptra that you think you like even better than filler for you being so young?
Correct.
Okay.
I think that right now I naturally have very full cheeks and a very full face.
Great full face, great full cheeks.
Face.
Love them.
So I wouldn't necessarily want to make it a little bit more plump or add a volume in the areas like the cheekbones, but I think adding a harmonious amount of volume with the Sculptra that isn't immediate effect, but I know in my brain that it's working in the long run.
Working in the long
Yeah,
run. Okay.
it makes me feel happy about it.
Great. So, you know, I wanted to take this tack because we tend to do sculpture in older patients mostly, but we are doing them in younger and younger patients who have the understanding that you have, Karina. So, you know, Karina, you look great. And what you want to do, and I'm trying to read through our conversation, what you're communicating out to our audience is that you don't want to look like a caricature of yourself.
Right.
So in other words, you have full Latina cheeks, and you don't want them to be overly filled. Okay. And as an example, all right. And so Sculptra gives us a more natural look, so it's more subtle changes. And there's an oxymoron phrase that I use, and you've heard me talk about it, and I say it's significant, subtle improvement.
Right.
And so how can something be significant if it's subtle?
Right.
But it's like jumbo shrimp. How can something be jumbo if it's a shrimp, right? But the significant, subtle improvement is absolutely true, and that's what gives rise to the results that you describe as harmonious, okay, and other people may say as natural. So when we inject the Sculptra and it's going to create collagen, we don't put it as a bolus just in one area, for instance, like the cheeks, and that would be your concern. I don't want to be overly filled in my cheeks. I have big, you know, I have full Latina cheeks, and I don't want that to be overfilled. So we place it or inject it more, I'm going to use the word diffuse, in a more uniform fashion in small amounts throughout the face. And so what it does when it adds volume is give you a very nice natural look. And I have a combination of filler and Sculptra in my face, and I really believe in it. I do believe that it is really one of the fountains of youth in terms of helping to stimulate our own biology, to create collagen, to help us to keep looking healthy, okay, and also to look younger. You know, who doesn't want to look a little bit younger, right? Okay, unless you're 12, then you want to be then you want to be 13. But pretty much after that, I think we all want to look younger. All right. So that's what Sculptra does, and so as we look at that, and a patient comes in for a treatment, tell me, how do we prepare this magical fountain of youth?
Yeah, so Sculptra comes in usually a box of 2, so we want to do roughly around 2 per treatment.
2 vials?
Vials.
Okay, so 2
vials.
little bottles. 2 little bottles.
Little bottles.
And what's in those vials?
And it's a powder form.
Okay.
So we have to, it's a 2-step preparation.
Okay.
So you know, we can prepare it when the patient comes in. Usually our nurse Mary is nice enough to get it all ready for us.
Okay.
The initial process. But
Thank
when
God for Mary.
Thank God for Mary.
Okay.
And when the patient comes in, we add local or lidocaine to.
So what we first do with that bottle of that powder of Sculptra, what do we add to that initially?
That bacteriostatic water.
Right. So we use bacteriostatic, meaning that it fights against bacteria like an antibiotic. So we use bacteriostatic water, okay, and so we mix that powder in it, and it forms a slurry, if you will. It's not a perfect homogeneous dissolving of the Sculptra material, but it's more of a slurry, okay? And so we fill that up initially with bacteriostatic water, and then the patient comes in, and you said you add what else to it?
We add lidocaine to it.
So we add local anesthetic to it.
More solution.
Okay, so we're
water.
diluting it
Yes.
more. Okay, so what we do is in that vial, it's a combination of bacteriostatic water as well as local anesthesia, so that it makes it more comfortable for the patient. Okay, so then we mix that up, okay, and then you're preparing the syringes for me, and usually it takes a couple of vials for a full treatment. And the way to know how much will I need over a period of time, we usually, as a guideline, will say that it takes about a vial per decade. Okay, so if you're 28, it may take 2 vials maybe for your first treatment, and then maybe a single vial for your second treatment. If you're 60, well, then it's going to take 6 vials, but we do 2 vials of treatment, so that's 3 treatments, okay? And we normally spread it out anywhere from 2 to 3 months in terms of the treatments themselves, okay? So we take this slurry, and then I freeze up the skin, so after I do that, you won't feel the needle pricks, as I'm using a little bit longer needle to injected in a more uniform fashion in the cheek area, in the area that it's called the buccal area. And for those who don't know that kind of anatomy terminology, think about sucking on a straw. And so it's in that area there, that what I call the straw sucking area, okay? And that area can kind of lose volume and then hang down, leading to jowls and so forth, okay? By the time you see that, you've already lost a lot of volume in your face. So what Karina has described, you having worked with us for so many years now, and she's become educated, she knows you want to get ahead of the curve, right? And that's what you're talking about.
Yes.
So you see when somebody walks in, and we'll exaggerate now, they're 120 years old, and now they want to take care of their jowls, or they want to take care of the deflated cheeks, is that it takes more to do.
Correct.
We have to use a combination of the hyaluronic gels, which is the Restylane and Juvederms, as well as Sculptra and other treatments. So it takes more. So you're kind of doing it prophylactically, if you will.
Yeah, that's what my thinking would be.
That's good. And I think it's actually great thinking. So a lot of times it's always interesting. Michelle, I'm talking to our program director, is like, what is the age range of people listening to us? When I first started on KSR, I thought it was sort of an older crowd, maybe the baby boomers, but it's younger and younger.
It is, yeah. I mean, especially right now, as people are interested in the news quite a bit, and certainly interested in their health as well. So I think you've got a range of people who are listening right
Absolutely. So we're getting the young kids, okay, like our Karina here, who are interested in these kind of treatments, and they don't want to look exaggerated. They just want to look good, and who doesn't want to look good, right? So I think that your thought of using Sculptra prophylactically, if you will, kind of maintaining your volume, so that all of a sudden one day you don't say, oh, what happened to my Latina cheeks, okay? Or why is my brow fallen, and so forth. That if you can maintain that, then actually in the long run, you had mentioned as we were driving over here that you think it's going to save you money in the long run.
I hope so.
You hope so?
I mean, I hope you're around for as long as I need all that stuff. But,
I'm planning on being around for a long time, Karina. So you will need less of the other treatments if you treat yourself, if you will, prophylactically. And even though you may think it's prophylactic in your late 20s, already there are the signs of aging. So it's a great way to start. So I really do think that younger and younger people are going to be looking at these biostimulators, using their own body to stimulate and keep them looking youthful, looking their best. And it's also good for us older people, okay, for us boomers, okay, the older generations, because we still have enough of our immune system to stimulate our own collagen production. It may take a little bit more. We mentioned it's a vial per decade. It may take other types of treatments like filler, and of course the neuromodulators you mentioned like Botox and Dysport, and of course great skincare. But all of this put together, I think that Sculptra is indeed a really great treatment, and is actually becoming extremely popular now. It's had a resurgence of interest from back in the many decades ago to now, where I really think it's taken a nice stronghold, and an appropriate stronghold of place in our armamentarium of helping people to look their best. And Michelle, you have a question?
I do. So you're talking about the treatment that you're actually injecting this in multiple areas of the face.
Right.
What if somebody's scared of needles, or does it hurt? Like, can you describe that?
Well, so we took care of a gentleman this morning. We mentioned how we kind of just sort of we visualize it and it happens. A gentleman who's just really slender, and so he doesn't have a lot of volume in his face, and he's had treatments elsewhere, and he was concerned about it. He expressed concern about the discomfort of fillers and so forth. So when we perform the Sculptra treatment, it really is great. I'm always lauding Karina in terms of how she's made us be a better office. And really her forte is helping the patients to get through treatments and to be as comfortable as possible. So not only is it just drawing up local anesthesia for me to use, but we do a couple of other maneuvers. But let's get first to the local anesthesia. So first of all, you mix the Sculptra you mentioned with local anesthesia with lidocaine. Okay, so before we do the treatment, you also give me a syringe of
local for skin.
Local, just for the skin. So you might feel, for instance, if I'm injecting the right side of the face, you might get 3 pinpoint point areas that I will inject local anesthesia in the skin. And before that, you usually give me ice, so I ice the skin down. Then we use the tiniest needles, and we inject in those 3 areas, so the skin is numb there. Okay, so if I have to go through an area, taking the syringe needle and going through that area multiple times, you're not feeling that pinprick, right? Okay, so we're doing that, and then you put the local anesthetic in the Sculptra solution for me. So although you will feel, you're going to feel some pinpricks, you're going to feel some pressure, but because of that local anesthetic that's mixed in with the Sculptra, it's going to numb up real quick.
Correct.
Right.
Yeah.
The potential downside of that is that it can sometimes be like going to the dentist and where you feel like your smile's a little crooked, or I'm talking like this, it seems a little funny.
Eyelids droopy.
Right. And that all goes away like in 10 minutes, 10, 15 minutes before you even walk out the door, that your function has returned. So that's just a very temporary local anesthetic effect. So that makes it comfortable. What else do you do to make it comfortable for them?
We have squeezy balls.
We have a
for the
squeezy
patient
ball,
to hold
okay.
on
All right,
to.
so they got a little squeezy ball that they're hanging on
We
to.
have a little vibration distraction device that can be used near the areas. Kind of takes your mind off of it. I like to also use it on their scalp. The patient commented, I might come back just for that scalp massage you gave me.
You're right.
So,
Okay, you're right.
Yeah, for the most part, it's we try to just make them as comfortable. And Dr. Tom's really great too. He lets them know, you're gonna feel pinprick, you're gonna feel all this, and kind of letting them know ahead of time what is to be expected.
Right. Like I used to with Robin when she was our co-host, I always used to tell Robin Berardini, I used to say that I'm the president of the Weenie Club, but I'm an empathetic weenie. And so, we always want to make sure that it's a real comfortable treatment for the patient. So we do those treatments. Karina does use we call it a distractor, and it's a vibrating device, and she'll put it on the scalp or kind of rub it on the scalp, and that vibration actually distracts the brain to feeling that, and it takes them away from where I'm working. So we use all these little tricks to make it very comfortable. And the fellow that we treated today, our patient, great guy, I love him.
Yeah.
And he was sort of amazed. He said, geez, I didn't hardly feel anything.
Yes.
Now, he's a tough guy, so I don't want to make it seem like you're not going to feel anything, because everybody's pain threshold or tolerance is different. Right, but he felt actually, I think he felt empowered to come back again for his additional treatments. And so that's really important for us, that our patients feel comfortable. So we've kind of described about the treatment itself. So now what can we expect? What do we tell them to expect after the treatment?
Okay, so usually you tell the patient, well, you'll look great, but then tomorrow or the next day you'll go, where did all this go?
Okay.
I looked great. What happened?
What happened, right. So it's important. We spend a lot of time educating the patient. So part of the Sculptra is the powder that we mix in the bacteriostatic water and local anesthesia combination, so it's fluid. So by just injecting the fluid, you look younger, okay? And so when we do that, you look in the mirror and go, wow, I love this. I mean, I already look 5 years, 10 years younger by just looking at that with my face lightly plumped up, if you will. Okay, and so you're loving it. And then in a day or two, your body resorbs the water and the local anesthetic, and it's like, wait a minute, where'd this go?
Right.
Dr. Tom sell me a bill of goods, what's going on here? I mean, what happened to my treatment? Well, what happens is and we educate the patient, so it's really important that they understand this, that after those couple of days where you're looking pretty good, and then your body resorbs the fluid, then over the next 2 to 3 months, your body starts to kick in, develop its own collagen, and you begin to see the volume returning. And so, and this patient that we talked about, our patient this morning, I asked him about the Sculptra, and he had some other treatments in the past, wasn't sure whether they worked, and he just really wasn't sure. I'm not sure I see an improvement. And so we took photos on him, and we showed it to him. And again, it was significant, subtle improvement. And when you looked at it, he looked healthier, he looked better, and so he was, really felt empowered to go ahead and do his additional treatment. So that's what you can expect with Sculptra, and that's the beauty of it looking so natural. And that's what Karina is talking about, is that it is all this significant, subtle, diffuse, if if you will, or uniform, or your word, harmonious, Karina, revolumization of the face that gives us those kind of nice results.
Yeah, it's a great treatment.
Yeah, it is a great treatment.
And we have a great special. So.
We do. You just led right into it. So I think I'm going to turn that over to Michelle there, but we do. And again, thank you everybody for listening about it. I love Sculptra. I've had it injected in me. It's a biostimulator, a great treatment. It's significant, subtle improvement that makes a significant difference for you.
That's great. So let's clarify then with this buy one, get one 50%. When you talk about someone needing multiple treatments, like,
Right.
you know, someone my age, 50, 51,
Okay.
and so would it be the first treatment would be, you know, the first purchase, and then the 3
second
months later
treatment.
when I come in would be the
50% off,
with
exactly.
the 2 next vials.
For the
Oh,
next 2 vials. Yeah, that's a great deal.
Love it. It's a great deal, and it's running through the end of October. So be sure to reach out to Dr. Tom's office if Sculptra is something that is interesting to you. Of course, everyone is individual, and it's great to talk it through and really just sort of figure out what is your specific plan. Call 707-542-8346. 707-542-8346. Of course, you can look at before and after pictures online, which is always fun, at drtomcosmetic.com, drtomcosmetic.com. Dr. Walter Tom of Dr. Tom Cosmetic Surgery.